Hi. Many people, as we age, will have at some point a discussion with a cardiologist. Heart issues are not uncommon, unfortunately. And so today I thought it might be a good idea to ask some questions that were commonly asked of an expert. So if you haven't landed here before, welcome to our podcast. This is Aging Gracefully with Julie Roca. I'm Julie Roca, and this is Dr. Cecilia Bato. And Dr. Cecilia is you've had quite an interesting journey. So tell us how you got where you are.
Well, actually, you mean my professional?
In your
Professional.
professional, yeah.
Yes. I came from Chicago, first of all. I graduated at Rush University, which is a respectable, reputable university, medical school, and they started their new acute care nurse practitioner program. I'm a nurse practitioner, uh, and I have a doctorate degree, so people call me Dr. Cecilia sometimes.
Yeah, I saw you have a doctorate degree in health administration.
Yes,
Yeah.
definitely. That was the path I was trying to go into. Um, I did achieve my goal. I did develop a lot of programs. Became the manager of programs, and actually, I'm the director of cardiovascular services at this time and co-owner. So for Pinnacle Cardiovascular Solutions.
So heart failure, what is it?
Well, heart failure is when the heart is inefficient to pump to supply the body's needs, and people develop heart failure after they had a heart attack, for example. Different diseases uh, you can result to heart failure, especially if you have coronary artery disease, even high blood pressure, even anemia, thyroid disease, all those things, cholesterol problems. People develop heart failure because the heart is trying to work, as much as it could to supply the body's needs.
It's not working at
It's
its
not,
best.
yeah, it's not working at its best. And people do end up in the hospital. Readmission rate for congestive heart failure is very high, it's about
Yeah.
23%. And and also about in 2018 they said 13.4% of adult died of heart failure.
Yes, it is. I think it is the number one disease right now,
Right.
right?
Number one, number two, chronic disease that's caused them to go to the hospital or high readmission rate for hospitals. And nowadays, hospitals are getting penalized for patients coming back within 30 to 90 days. And every time patient goes into the hospital, their heart gets weaker even, and they end up with so many different things.
Okay.
Uh, you know,
So and that's one of the things that I really like about you. Do you have an office?
Yeah, we have an office in Ocala.
Mm-hmm.
We have 9 different offices, 4 cath labs in the area.
Okay.
And I'm partnered with an interventional cardiologist. So, you know, we want to make sure that patients are healthy, you know, cardiac wise,
Yeah.
cardiovascular. Also, if they do have blockages, we do try to address them.
Yeah.
With heart failure, there are certain things that patient has to do to prevent those worsening of their symptoms.
Okay.
Because once you have heart failure, you do have heart failure. Your goal is to improve your pumping action and prevent um, exacerbation of your symptoms. And when you have heart failure, you have a tendency, or if you don't follow the regimen, if you're not on the evidence-based heart failure medications, you don't follow your salt diet, you don't monitor yourself. Yeah, salt is a very
It is a big
big thing
component. Yeah.
component for
Yeah.
getting fluid buildup, I would say.
So, so one of the questions that you get asked regularly is, "Hey, I have heart failure. Will my heart get better?"
Yes, definitely. Of course, those patients and families are afraid what happens after, the doctor tells me that I have heart failure. You do get once you have heart failure, like I said, you have heart failure. Your
Yeah.
goal is to prevent your heart failure from getting worse, the pumping action from getting worse, and also preventing yourself to get this fluid buildup so you don't end up in the hospital. Because, like I said, every time you go into the hospital and have this fluid buildup, your heart, of course, your weak heart works harder, so they can get
Yeah.
weaker.
Yep.
You don't want your heart to get weaker.
But do you think that there's a way to strengthen the heart? For
Oh,
example,
yes.
are there certain exercises that you can
Yes.
do? And obviously, diet is going to be a huge factor.
Yes, a huge factor.
Yeah.
Your heart is a muscle, so like any, you could
Okay.
exercise it.
Yeah.
Now, in the old days, when you have a heart attack, you stay in bed for 1 month.
Okay.
Nowadays, no, you don't do that. You're actually, I set up protocols for the hospital I used to have my clinic, and patients I have the order there that they should be up out of bed, at least with meals.
Wow.
The second day, even open heart surgery,
Wow.
they're up the next day, trying to walk and all that
Oh
stuff.
my goodness.
for the next
Because
few
I
days.
remember my grandmother had open heart surgery and she was in the ICU and I
With all
think they
those
kept
tubes,
her.
right?
Yeah, they kept her under for days. I remember being really scared. I think I was about 12 or 13 and they let me in there to see her and I just remember being so scared cuz she was out of it and not moving for
Right,
a
right.
while.
Yeah. No, after you have a heart attack, you go for rehab. You could do cardiac rehab and
Okay.
make sure you get stronger. Because anytime when you're in bed in the hospital, it takes 4 days. 1 day of bed rest takes you 4 days to get back to where you were.
Wow, we've
So
come so far.
yes, therapy is very important for the heart. So I
Gotcha.
would say.
Okay. So we're talking about, what once you have heart failure, how can you improve? How do we prevent it?
Well, prevention is also, we want to do prevention nowadays. It's not like the focus of healthcare nowadays is not just treatment, but prevention.
Yeah.
So, very simple. If for example, if you have high blood pressure, make sure you control your blood pressure. If you have diabetes, make sure your diabetes is under control, because any other disease can,
Wear the heart down.
right, of course, because the heart is trying to work harder
Yes.
with
Yeah,
all
that
this
makes sense.
stuff.
Yeah.
So you have to regular visits to your doctor. Make sure you do your blood work. Make sure everything is fine. Exercise, regularly.
Yeah.
Eat a healthy diet. Stay away from salt, of course.
Yeah.
That kind of
Oof.
help you.
That's my weakness.
You build up fluid that way too. Especially if you have a weak pump.
Yeah.
The organs of the body looks at the heart to help them out. So if you have a weak heart or weak pump, your kidneys doesn't get what it needs to kind of work properly.
Right.
That's a simple way to look at that.
Yeah.
So they don't eliminate fluid, normally. And if you have heart failure, they are on water pills or what we call diuretics
Yes. Right.
to kind of make the kidney work harder, so you eliminate the fluid and you don't build them up.
Wow. But that's
Because-
even harder harder on the body in general.
Oh yeah,
Yeah.
definitely.
So I'm wondering, this generation that's coming up, I've got 5 children, and they're young and energetic, and I'm hoping that this generation does things better so that the heart doesn't wear out as much. Do we know enough to say, hey, here are the things that you need to do when you're in your 18, 19, 20 years old to maybe have better quality of life when you're in your 60s and 70s and 80s?
Definitely, you don't abuse your body. So stay away from smoking, alcohol.
Yeah.
Live a healthy life, exercise, watch your diet. Those simple things. And I know we learned that when you were younger, growing up. Stay
Well, you
away from
hear it, but you don't think you need it until
right.
all of a sudden, you're in your
Something
60s
happens.
and something happens and you're like, oh man, I should have paid attention to that. right?
Yes,
So
definitely. Yes.
that's part of what we try to talk about here on Aging Gracefully. We're all aging.
Mm-hmm.
So, what do we need to do to make, the end of life, those winter years better? And
Mm-hmm.
I want to start thinking about it now. And I want my children to start thinking about it even
Yeah.
now. So, yeah,
The
these
good thing
conversations are
nowadays,
important.
though, there's so many things that was discovered. The technology we have, the medications that we have, they're, I would say, they can improve your life. You get this opening up of the blockages that we have in the heart.
Yeah, yeah.
So those things, new medications coming up and all that stuff. So
Yeah, and you mentioned in our discussion beforehand, you had a story about a younger patient that had heart.
yes,
Share
yes,
that with
right.
us.
I had a patient that was referred to the clinic after he had a heart attack. He ended up having a weak heart. His pumping action or ejection fraction is about 15%. He does have bad genes. His father died when he was very young, so he knows that I'm up for trouble when I get older.
Gotcha.
Anyway, he was referred to for a heart transplantation because he was very young.
Yeah, 15% is
Yes,
almost nothing, right?
right, right.
Wow, his heart must have been working so hard.
Yes. Anyway, he did. They fixed the blockages. He was placed. We placed him on evidence-based medications.
Yep.
And kind of give him a teaching in the clinic because it's very important that he knows what to do. He was also discharged with a cardiac life vest.
Okay. Yep.
That is the life vest actually when it recognizes a dangerous rhythm, they would shock the
Yeah.
patient and bring them back to normal sinus.
So it's
So
not as invasive as the pacemaker.
no,
Yeah.
the pacemaker is implantable. But you will end up, if your heart pumping does not improve and it stays low,
Yeah.
35% below, then you end up with a defibrillator slash pacemaker. So he was up for that, and he was placed on the transplant list, but that
Yeah.
takes a while. So anyway, during that time, the goal is to optimize his medication, meaning increasing the heart failure medication, that his blood pressure is acceptable, his heart rate is acceptable, he doesn't have any fluid buildup. And eventually, after 3 months to 4 months, when we repeated his echo, his pumping action got better to 55.
That's great.
So he didn't end up having a defibrillator pacemaker and what we call biventricular pacemaker, or he didn't end up with a heart transplant.
So with education,
Sure.
some of the new evidence-based medication, and following the proper protocols and staying in contact with physicians,
Yeah, follow up.
he
Yep.
greatly improved.
Yes, definitely. I have a lot of
Wonderful.
stories like that. So,
Oh, that's probably why you do what you do, because
yes.
you are making a difference.
Yeah, that's the prize
Yeah.
for me.
So do you go into if someone is in an assisted living, do you go and visit them in the assisted living, or
Yes.
do they go to your office to see you?
Well, this is a new project for me.
Yeah.
I am going into the assisted living facilities, independent living facilities, NIFs and rehab, those facilities, and provide cardiovascular care to those residents. So that they will stay healthy, stay in their facility. Those facilities are basically their home.
Yeah, they are.
Every time they get to the hospital because of their fluid buildup, then sometimes they end up somewhere else,
Yeah, yeah. So that's the goal, is to keep them out of the hospital.
and keep them healthy. Yes,
And it's so convenient that you're now making basically those house calls and
Right.
visiting them in their home of choice. It's a huge benefit when I'm chatting with family members about placing their family. It is such a difficult thing, I think, for families to wrap their heads around. Okay, now my parent has all of these appointments and I need to get them back and forth to doctor's appointments. It's
Yes.
so nice when the physician is visiting them in the home of their choice and the family doesn't have to worry about the transportation and all of
Right.
that.
And plus, it's taxing for the patient.
It is very taxing.
It's
Yeah.
very hard for them to get in and out of the car, get into the office, wait, a long time to get seen, wait for your turn,
Right.
and
Yeah.
all that stuff. We also can bring non-invasive procedures, testing to the facility, like an ultrasound of the heart or echocardiogram,
Oh my goodness, it's great.
ultrasound of the legs, arterial, and all that testing to kind of so they don't have to go out.
That is fantastic. Absolutely wonderful. Are you also visiting communities up here in Gainesville, or are you mostly trying to stay in the Ocala area?
Oh, no. I'm all over the place.
Oh, okay.
Wherever we are appreciated. I even before having this project, I've been all over. I did primary care for like 6-7 years. I also co-own that company.
Okay.
But I plan to be all over as well, as long as they need me. So Ocala is, where one of our offices, and Marin County, Sumter, Alachua, even went down to Lake City. We have an office there and a
Wow.
cath lab there.
Wow.
So we're all over the place.
are.
Ocklawaha, Oxford,
Yeah.
the
Yeah.
villages. I have a series of lecture. One is in the villages and one is in Lake City on the 22nd and 23rd of this month.
Very nice.
It's a heart month. So,
Oh, yeah, it is.
and
It's
I have
Valentine's
I
Day.
have a lecture for staff next week.
Okay.
In
Very
Ocala,
nice.
in Marin County.
I don't think I'll have this out in time to post anything for that, but I will actually post ways that people can connect with you. So if you are doing educational programs, they'll be able to find you and find out how they can get more of those educational programs.
Sure.
If someone is not in our area, how would they go about finding someone like you? As somebody who can specialize and help them out, what would be the process?
Well, I do have a marketer, that goes around. He's all over the place. He's very, very energetic.
That's
I
our
would say.
Ryman.
Ryman Reyes. And he can be anywhere.
Yep.
He's on all events. In fact, I am in all events also. So it's very easy. We can give you my cell number,
Okay.
his cell number, the office number, and the intake person we have is Michelle Stopper.
Okay.
And just give Ryman a call.
Okay.
And we'll be there.
So, does your patient need a referral from a primary care physician in order to start to see a specialist on your level?
Well, just because we don't want to step on anybody's toes, I would like a referral.
Yeah, sure.
From the primary care,
Yeah.
if possible. It's still, patient's choice. He can easily, or she can easily tell the primary, I would need to be seen by, us.
Yeah.
But just because he's under the care or the patient is under the care of primary, and usually primary is still the captain of the ship.
Yes.
So
Yeah.
just with respect to them.
So, can annual blood work show that there's an issue?
Oh, yeah.
Okay.
That's why you go for those annual blood
Okay.
work. Depending on your case, it may be more than annual, depending on the situation. Right.
often.
But if you're healthy, like you said, prevention,
Yeah.
you do your annual visit to your doctor, make sure everything is fine. And also, like I said, live a healthy life
Yeah.
as much as possible and
Okay.
exercise.
Yeah. So even if somebody is outside of the state of Florida and they can't get to you, they're going to go see their primary care physician on a regular basis to get a heads up if there's something
Right.
starting to happen. And then,
And be compliant.
Yes.
Be compliant of the regimen that the doctor tells them to do. So
it's amazing to me how many people are not compliant with what the doctors say, and then they're shocked when things
Right.
go wrong.
and usually it takes some event to kind of,
Yes.
hit you in the head and said, oh, I got to really be serious about my health. So.
Yep. And then that's when I get the calls. It's when a life event normally has happened and they're saying, uh-oh, now things are changing for me and I might not be able to live at home alone. So,
Right. And a lot of people don't have anybody.
yeah.
That's what I
know.
did home and in the community, a lot of patients or they don't have anybody.
Yeah.
Very sad.
Yeah.
So
I'm going to ask a question that is a little bit more intimate. And if kids are listening, parents close their ears or whatever. But I know that a lot of questions come when people want to be intimate and they have heart failure. And it's a worry, it's a concern. I mean, intimacy is an important thing for couples. So I know you get asked a lot,
yeah.
can I be intimate? And so what is your answer?
Well, especially for the younger bracket of my patients, I do get asked about that. Well, first of all, they have to check with me.
Yes. Yeah.
They should be on those right medications. They should be stable. Their vital signs are stable, but they can have sex. Not just wild sex. I mean, I would say moderation. Anything in moderation.
Yeah.
And I'm sure, that's part of being, human, I guess. So I do say they can have it, but with very, I would say, very cautious about it. You know what I'm saying?
Yes, and being very careful.
Right.
You didn't know you were signing up to also be a sex therapist, did you?
Yeah, I know. I even joke with this couple, a young couple I had before. I'm not a sex therapist,
Right.
but I do, and actually the wife, asked me. I says, Dr. Cecilia, can I talk to you in private? I said, sure. I thought it was something, but that's what she asked me, and I went back to my patient and kind of discussed it with them.
Yeah, that's good. Yeah.
Openly, But generally, I'm honest. If I don't think that they can have it, then I tell them. There are other means of showing affection.
Yes.
You know what I'm saying?
Intimacy, it doesn't have to all just be about sex.
Right. So I
Yeah.
do. It's like I'm a sex therapist now. So
I know you put that in the sheet, and I thought, yeah, but that's a question that's asked a lot. It's definitely one I've asked before. So,
yes.
Well, thank you. We've covered now a broad
sex.
base of things, and I am so grateful to have you here today.
It's my pleasure.
Yeah.
It's my
So,
pleasure.
who knows if I get another list of questions, we may end up having you back.
Yes,
I'm very
I do
excited.
have a lot of funny situations, and I do play with my patients. So, and a lot of, but the most important thing is that they do get better. They have improved quality of life. So that's my, my price of being a provider. So.
That's so encouraging in this day and age that there can be improvement, that quality of life can improve.
Right. I'm just talking about
exciting.
the 34-year-old guy.
Yeah.
I have
Great
a few
story.
more of that. So.
Yeah. Well, thank you so much
Thank
for
you.
coming. And if you haven't already liked and subscribed this video, please make sure to like it, subscribe, and then make sure you share it with someone who may be kind of wondering if their heart is okay, or even those that are younger. We are all aging, and we need to do things now, today, to prevent some not nice things down the road. So thank you so much for joining, and I hope we'll see you next time.
It was fun. Have a good day. Have a good day. Thank you.